welcome to Across the Fence. I'm Jolie Whitney. May is the month to raise awareness for cystic fibrosis. This is a genetic disorder that affects the lungs, digestive system, and other organs. The symptoms are often painful, and many who suffer from CF are children. Fortunately, with proper medical care and support, kids diagnosed with cystic fibrosis can live a normal life. To talk about the disease and learn about clinical trials going on at UVM, I'm joined by Thomas Lahiri, a professor of pediatrics, division chief for pediatric pulmonology, and director of the Pediatric Cystic Fibrosis Center at the UVM Children's Hospital, and Charlotte Teneback, associate professor of medicine and director of the Adult Cystic Fibrosis Program at UVM Medical Center. Doctors Lahiri and Teneback are with the Cystic Fibrosis Clinical Research Group at the University of Vermont, which is part of a larger international network of clinical trial sites. Welcome to both of you.
Thank you.
Thank you.
So you guys are clearly experts on this topic. So let's first, I gave kind of the dictionary definition, but first walk me through what the symptoms are.
So actually, cystic fibrosis is usually diagnosed nowadays through newborn screening tests. So babies, when they're born, usually don't have symptoms. They might have a blockage in their intestines. That could be the first thing. But really, as time goes on, you get repeated infections in the lung or chronic cough or respiratory symptoms that can develop. And then there's most kids and adults with cystic fibrosis have digestive issues. So they can't digest protein or fat, so they have trouble gaining weight and have issues related to that.
And if it's not diagnosed at birth, is it diagnosed later on, or are you looking out for those?
It can definitely be diagnosed later on. So sometimes diagnoses get missed at infancy, and Dr. Teneback, continues to diagnose adults with cystic fibrosis based on usually lung symptoms and recurrent infections that develop later on.
Yeah, absolutely. Dr. Teneback, is this strictly genetic?
It is, yeah. It is caused by genetic mutations. There are over 2,000 of them that we know of.
So is it something that can be prevented?
No, it cannot.
And how many people in Vermont usually live with cystic fibrosis?
About 150.
So not a very big number, or is that pretty much the same across the country?
It's a rare disease, and there's over 30,000 people nationally, but overall not large numbers compared to some other diagnoses or diseases.
About 1 in 2,500 people in the U.S. are born with cystic fibrosis. So. And
Dr. Lahiri, there are two cystic fibrosis programs at UVM. One is for children and one is for adults. Is that right?
Correct.
So what are they doing? Is their work relatively similar, or is it different?
Yeah, in some ways we're very similar teams. We share same team members with different disciplines, but the focus is a little bit different in the pediatric and adult program. Complications are different during adulthood than during pediatrics, and we have a larger focus on kind of like early growth and nutrition in the pediatric clinic. But we work closely together, and just to put it into perspective, the pediatric clinic used to be a lot bigger than the adult clinic, and now things have flipped, that there are more adults in the US with cystic fibrosis than kids because people are doing so much better.
Yeah, that's incredible. Walk me through those interventions early on that help kids do better with cystic fibrosis.
Well, I think for years the focus has been on just attaining normal growth and nutrition for infants and young children with cystic fibrosis, and that actually helps prevent some of the lung complications. But over the past several decades, there have been a lot of treatments to deal with infections in the lung and to thin out the mucus, which is thicker in cystic fibrosis in the lung as well. And then more recently, over the past 5 to 10 years, there have been really incredible therapies that have come along to help basically reverse a lot of the changes that we see in cystic fibrosis.
And he'd mentioned some complications for adults with cystic fibrosis. What do those look like?
A lot of people have significant lung complications. So infections that can become more difficult to treat, bacteria that are harder to treat, and sometimes the need for a lung transplant. Along with the ongoing gastrointestinal issues as well, and very frequently diabetes.
And what is a CFT modulator?
CFTR modulator is a small molecule drug that's been developed. There's a number of them that have been developed over the past decade that actually try to correct the basic defect in cystic fibrosis. So there's a channel that sits in cells throughout our body, in the respiratory tract, in the intestines, the liver, lots of other organs, and that channel doesn't work properly. So the CFTR modulator actually allows that channel to open up and work properly, and that makes secretions or mucus less sticky in a lot of different organs, and that can prevent a lot of the complications.
And UVM recently finished some clinical trials about cystic fibrosis. Tell me about those.
Yeah, we do a number of different clinical trials in CF. The one that we just, that was just kind of completed was about a new modulator. So one of these medications that can really help improve the symptoms, thin the mucus, and really kind of reverse the effect of the genetic defect.
Sure, and why are these clinical trials so important?
Well, the clinical trials are necessary to bring these new medications to the market and to everyone who needs them. So it's really been exciting to get to be involved with this and see these trials be successful and see these medications become available for so many people.
And we were talking a little bit before the taping started about how much has changed since you've both been working studying cystic fibrosis. So how has the treatment changed and how has life expectancy changed with these great studies?
Yeah, so I've been at UVM for 24 years now, and the life expectancy has doubled since I've been there. So we used to have a lot of children who were sick and in the hospital. On any given day, I would have between 3 and 10 kids in the hospital, and now I have usually 0 to maybe 1. So it's been a tremendous change. So people are able to stay healthy, stay at school, and participate in normal activities. And it's really like a testament to all the different therapies that have come along over the past few decades.
Sure, that must be huge for quality of life as well.
Absolutely. You know, we've seen, for adults, people being able to make decisions that maybe they weren't going to make before, like having a family or starting a different career. You know, just a lot of really, really exciting opportunities for people to be able to do without being sick all the time.
Absolutely. Now let's go back to those the studies that you guys have been doing. Who's helping with these programs?
Well, we have a whole research team at the Vermont Lung Center with research coordinators who do a lot of the day-to-day stuff for the studies, as well as support, from financial management team. And a whole lot of people in the background,
Sure.
from contract
Some
negotiations.
unsung heroes.
And yeah, it takes a lot of people to make this work happen.
Absolutely. And are the participants in these studies all Vermonters?
Vermont and upstate, Northeast New York State, because those patients also come to the Vermont Center.
And we said in our intro that you guys are working with a larger national program, is that right?
Yeah, the Therapeutic Development Network for the Cystic Fibrosis Foundation kind of coordinates a lot of these trials, and some of these are supported by pharmaceutical companies like Vertex, which made a lot of these CFTR modulator drugs, so they work together to bring these trials to patients.
And how do you find the patients that you're working with here? Is it just people who've been getting care at UVM?
Largely, yes. Yeah. And many people with CF know about these trials, so sometimes they'll come to us and say, I heard this study is coming, I'm really interested in that. And we have our research coordinators come to our clinics to meet with people so that they know them, and people who are interested in research know who to reach out to as well.
And is this a study with kids or adults, or is it a mix of both?
It's a mix of both. So in this most recent trial that we've been talking about or referring to, there were more adults than kids. It was 7 adults and 3 kids in that particular trial. It's a little bit tougher to kind of get kids into trials. They don't all qualify for the different trials. So.
Sure. And do other clinical trials take place at the CF centers?
Yes. Yeah. We do a number of different things. We're starting one for a different modulator coming up, but also treatments for infection, all sorts of stuff.
Yeah, inflammation, trying to test out best treatment strategies when people do get sick and what to do next. So those are all part of the clinical trials that are ongoing.
Sure. And when we're talking about genetics, one thing that comes up, especially in the modern scientific era, is CRISPR. So why don't you walk me through what that is, and also if that's something that people have looked at with cystic fibrosis or where that stands in the science? Yeah,
so that's definitely an up-and-coming potential treatment for cystic fibrosis. It's a way of editing the gene to insert a normal copy of the, to fix the mutation that's there and make it function normally. And so that's been accomplished in some other conditions, and cystic fibrosis, there's some active work on that right now, and that would actually solve the problem that many patients have. And not every patient actually with cystic fibrosis qualifies for a modulator. So it's about 7 to 10% of the population can't actually use these great drugs that are available. So a technology like that would, really be important for that particular group.
And we talked a little bit about funding, about how these studies at UVM are funded, but even nationally, scientific funding has maybe been scaled back a little bit, or there's some concern about that. But what's the importance of these continued studies?
Well, we need ongoing studies to further the way that we provide care, to provide new medications, and many of the advances, if not all, in cystic fibrosis over the past decades have come out of clinical trials and the information that we've learned from those. So it's really critical that we're able to continue this kind of research.
Absolutely. And what should somebody do if they're worried that they have symptoms of cystic fibrosis, or is that something that we would likely already know?
Well, you don't always know it. So I think, we rely on our primary care physicians out there to kind of know about the condition. We try to educate the community on signs and symptoms of cystic fibrosis. A lot of them learned about it in their training. It's changed a little bit since we pick up so many in newborns right now, but you just have to have that suspicion. So if things aren't making sense and people have chronic respiratory or even gastrointestinal symptoms that could be consistent with cystic fibrosis, it's not that hard to test for it.
Sure, doesn't hurt to ask, I'm guessing.
Right, yeah.
And remind me one more time, if somebody comes in and they're a newborn and they've been diagnosed with cystic fibrosis, what is the process to kind of help mitigate those symptoms later on in life? Because it sounds like you guys are doing a great job preventing a lot of people from having these long-term problems.
Well, so we can't start these modulator drugs instantly on babies. They haven't been studied down to the youngest age group, but many of the most effective modulators are actually, patients can be eligible for that as young as age 2 at this point. And even if you have certain mutations in cystic fibrosis, you can even start them during infancy. But really, until we can get patients on those drugs, it's really about prevention and proactive support of their growth and nutrition.
All right, thank you so much for joining us today.
Thank you very much.
Thank you.
And for more information about the cystic fibrosis care at UVM Medical Center, you can visit the website on your screen. That site has all the information you'll need, as well as a link to subscribe to a quarterly newsletter. I want to thank the crew behind the scenes here at WCAX who make our program possible. I'm Jolie Whitney. This is Across the Fence. Have a good one.